Hello, everyone. My name is Jennifer Donnan, and I'm really pleased to be here today to talk a little bit about the work that my team has been doing in Newfoundland and Labrador with our cannabis policy evaluation. And today I'm specifically going to be talking about the impacts of cannabis legalization on youth and young adults. So in terms of the focus of this study, we really had three main topics we wanted to address. We wanted to look at youth access and consumption. We looked at road safety and driving under the influence, and also cannabis education. What is it that youth are currently getting, and what would they be receptive to, and what are their needs moving into the future? This study was a qualitative study, and we did focus groups with youth between the ages of 13 and 18, as well as young adults between the ages of 19 and 25. And we talked to a total of 91 individuals from across the province as part of this study. So I'll quickly talk about what we had found, and I won't spend much time on cannabis access and consumption, but just to say that consumption is really common as much as it always was, and that access is perceived to be much easier now where it is legalized. I really want to spend some time talking about cannabis and driving under the influence among this population, though, because there was a lot of interesting findings here. And so I'll talk about how our data kind of fell out into six main themes. So we heard about the normalization of driving after using cannabis. We heard about the peer pressure that youth experience. We've heard comments around their lack of knowledge and awareness of the risks associated. Some of the misconceptions or risk perceptions of youth when it comes to driving, how modes of transportation influence choice, and then detection. And so I'm going to highlight each of these themes by bringing out some of the quotes from our focus groups. So with respect to normalization, someone said, people aren't hiding the fact that they're using marijuana as much where it's legal. You've definitely seen a lot more people using it on the roads. And it's not just in the shady parking lot or on a back road on the way to the cabin. It's just driving down the cross town, and you can smell it. And people are riskier when they're using it. It's just very normalized. You've also talked about experiencing a lot of peer pressure, not only to use cannabis, but then to drive afterwards. And so one person said, I feel like people don't think much about it. Like I would say, if I were to tell my friends I wasn't comfortable driving under the influence of cannabis, they would think I was just being like soft or something. They really don't think it's a big deal at my school. And this is a concerning misconception for sure. In terms of knowledge and awareness, there was a lot of talk about how it's just compared to alcohol and there's no concrete facts about the impacts of cannabis. And so one person said, we have organizations like MAD that show the really graphic and emotional videos of drunk driving, and we don't really have that for cannabis. So it seems like the government is just trying to piggyback off drunk driving campaigns, saying it's the same thing, but the information isn't there, not in the same way. And then for risk perception, there was a number of misconceptions that we heard about. And the first I'll speak to is the fact that a lot of people believe cannabis makes them better drivers. And so, as this quote indicates, I think people think that weed or marijuana slows them down. So they're going to be more careful where alcohol makes you impulsive and not as careful. And I think that might be the perception that people have when they're making the conscious decision to drive under the influence of weed. We also heard about tolerance and how people who consume cannabis regularly have a level of tolerance and that they're better drivers under the influence than someone who's less experienced. And so somebody said, I definitely don't think it's the same level of danger. I trust people like men who have cars and drive high if they've been smoking weed for a while, if they have a lot of experience with it. And so it's not just taking on the risk, but they actually have a level of trust. Modes of transportation was also an interesting finding as youth compared driving on-road vehicles versus off-road vehicles and how off-road vehicles are perceived as much safer. So as one person said, if you're out at a cabin party or something, snowmobiling on an ATV, it's not even a big deal. It doesn't seem like people even think twice about getting behind the wheel. There's definitely less of that second guessing and thinking about it. And then finally, when it comes to detection, people did indicate that they could easily hide the fact that they've been using cannabis from their peers, from the general public, as well as from law enforcement. And so one person said, I think with alcohol, it's more obvious and you can prove it. I know you can prove it with cannabis as well, but it's a mental thing. You can snap out of it and pretend not to be high and fool the people around you. And also when it comes to detection, they commented, especially in rural areas, there's just not a very heavy police presence. And so they might only come through the community once a week or once a month. So we have a couple of RCMP in our jurisdiction. And if we get them come by every now and then on a long weekend, where they'll just pick a weekend and go. So there's definitely not a continuous presence there or risk of detection. And I'll quickly speak to cannabis education. And this slide speaks to what youth feel they're learning about now and where they're getting their education. So they talked about at home, there's really minimal to no cannabis education for a lot of youth. And usually when they do get it, it's a very abstinence or scare tactic approaches. They talked about getting a lot of their information from their peers, their own age or older, but the conversation is usually casual, very positive and vague. The school system, they did indicate, lacked formal education. Again, often the scare tactic, abstinence approach that even they recognize is not an effective strategy, and that posters just really aren't an effective means to communicate messages. They did talk about that they learned a lot about cannabis through social media. So from things like TikTok, Snapchat stories, about the different strains, the composition, and the products. So it seems like peers and social media is where youth are focusing their attention for getting education. And now we'll speak to the implications, which again is part of our results because we really wanted to talk to youth about how we can fill this gap and how they would be receptive to receiving education. And so here are the four, I guess, main areas that youth felt that they would like to learn more about when it comes to cannabis. So cannabis consumption and its intended uses. They talked about the lack of accessible information, especially on the positive impacts. It's really focused on the negative for the youth population, but they know there's positive and they're not hearing about it. And they want to know how to consume it safely. So even from them, these harm reduction strategies, they recognize that those are important to them. And so how to consume different types of products safely, how to prevent harm to oneself and others, and just not to use that abstinence approach. They want to hear about the long-term effects. They've heard lots about mental health, the impact on the developing brain, but it's the specifics. They really don't understand what is that true impact. And then in terms of short term, of course, the impact on driving, they don't want to hear that it's just similar to alcohol. They want real facts and the side effects that maybe these different products can cause in the short term. But I think the overall theme here is that they really want evidence-based information. It can't be just glossed over and vague information. It has to be the real thing. When it comes to delivery, they had some really great ideas to share. So they want education to be interactive. They want to be able to ask questions and not just be passive listeners. They think it needs to be delivered more than a one-time session. They talked about, comparing it to the MAD program and how that was really effective. They want external speakers, relatable speakers that are really knowledgeable about the topic. There was mixed messages about teacher involvement, but pretty unanimously, they didn't want police involvement due to a poor rapport. And they said it needs to start young. Cannabis use among youth can start as early as grade 3 and 4. And so it really needs to start at quite a young age to get that information to people when they need it. And then, of course, we talked about social media being a really effective strategy. And they said that it's great because it's easily accessible and has a wide reach. But any social media education needs to align with current social media trends, not things that were popular just 5 years ago. TikTok was definitely the top recommendation, but these videos don't have to come from just their peers. They can also be from, they also follow like respected health professionals, for example, pharmacists, doctors, psychologists. Often there's a number of TikTok influencers with a large following among the youth population. And then of course, Instagram, Snapchat, YouTube were also recommended, but they do like that TikTok style. I guess it's the short videos that were really effective. And anything that looks like an ad or something that's sponsored is likely to be skipped. So in conclusion, I just want to thank our team and the awesome group of young adults that we had work with us this summer to be able to conduct these focus groups. So thank you all very much.